Okay, today is about an axial plane of CT scan at the mid-sacral region. Okay, at this area, okay, we start from the front. Um, Here is the fat, okay, subcutaneous layer. This one is the muscle layer. Okay, this one is the rectus abdominis. Rectus abdominis is origin um, from the Ziffert process. Okay, from the Ziffert process and the costal cartilage of the fifth to eighth to fifth to seventh, to fifth to seventh costal cartilage, and then goes downward to the pubic symphysis and also iliac crest and iliac ischial tuberosity and ischial body, ischial tuberosity and ischial tuberosity and ischial tubercle. So near inside the posterior to the rectus abdominis, there is a inferior epigastric artery and inferior epigastric vein. Both originate from the external iliac artery and external iliac vein and go southward, and it will anastomose with the superior epigastric artery, which is originate from the internal thoracic artery. Okay, and then we goes more posterior. This is the perivesical fat, perivesical fat, okay, surround the bladder, and this is the bladder. Okay, bladder, it will be a square shape when it is distended. It is an extra peritoneal organ, which is situated at pelvis. Okay, posterior to the bladder. Okay, posterior to the bladder is the seminal vesicles. Seminal vesicles, which will join the ductus deferens, and will form a ejaculatory duct. Okay, posterior to the seminal vesicles, which there is a layer which separates it with the rectum, is called as a perirectal fascia, and it will be surrounded by the perirectal fat. Surround outside the perirectal fascia and fat is the pararectal fat. Okay, okay, okay. From it goes to more lateral. More lateral. Here is the internal obturator muscle. Internal obturator muscle from the obturator medial side of the obturator foramen. It will goes to the greater tubercle. It will form the gemellus superior and inferior. Okay. So in front of this one is the ischial spine. This is the ischium, and in front, there is a two muscle here. The first muscle is the psoas muscle, which is more medial, and this one is the iliacus muscle. Both muscles, the iliacus is come from the iliac crest, from the iliac crest, and the psoas muscle is from the transverse process of the lumbar vertebra and goes downward medial to the iliacus, and then insert into the lesser tubercle, the only muscle that is inserted into the lesser tubercle. Otherwise, other muscles will be inserted to the greater tubercle. Okay. The obturator internus, it will go from the internal, from the medial side, from the internal, it will go southward through the lesser tuberous ischial spine, lesser ischial foramen, lesser ischial foramen, and inserted into the greater tubercle. Behind the greater tubercle. Okay, behind the ischium, but it's originate from the ilium. Okay, these three muscles of the gluteus muscle, the gluteus minimus, gluteus medius, and gluteus maximus. Okay, so behind this, it is the sacrum. This is the mid-sacral region. Mid-sacral, and below that there will be a sacrum. So the vessels, the most important vessels that we have to remember in this slice is the epigastric muscles, inferior epigastric muscle, which is originate from the external iliac arteries and the external iliac vein, and if we sometimes in the delete phase we can see ureter, which is will join the bladder at the posterolateral side of the bladder. Okay, that's all. Thank you.